things?
Okay-ish.
Yeah.
We're kind of holding our own, which is reassuring, but nobody's fully relaxing yet. But we're, so far so good here in California and in Santa Barbara as well.
I love Santa Barbara.
Yeah. Yeah.
One of my very favorite places, honestly. I'm not just saying that. It's not like everybody I talk to, I go, oh, Chicago, my favorite place. I really love Santa Barbara.
Yeah,
I have some good friends there, and I used to be out in LA a lot, and used to always take at least a day to go up to Santa Barbara. It's beautiful.
Yeah, it really is, and I really appreciate that.
So, can I ask, right now you're at home, correct?
Correct.
And I see that you have some sort of feline with you.
I have, that's one of them, yes.
Yeah.
Yeah, that's the one.
Who else is in your household, if you don't mind me asking? Like, when we shelter at home, I'm always interested to know, like, who that is with, if you don't mind me asking.
Yeah, so currently my husband has to be in Hawaii for family medical reasons. So I was just about to visit him again on March 23rd, and we both decided that that wasn't a good idea. So I am actually here with me, 2 cats, 3 dogs, and 2 turtles. And that's my shelter group.
Now, are they turtles or are they turtles?
They're like about, this turtles. My daughter bought them home from Chinatown 2 years ago, and they were that big. So when she had a friend taking care of them for a while when she was at school, and we said immediately, you have to find somebody else to get the turtles. Then we kind of fell in love with them. So they're aquatic turtles. They're in a big tank. And so
I understand.
So that's my shelter at home group. Yes.
My daughter had a little turtle that became a bigger turtle, and then a bigger tank, and then the UV light, and then the little island to sit on. And
yeah.
All right. So if things were normal, we would be talking about environmental medicine.
Yeah. And my patients still are, I'm still speaking with them. They still are dealing with the same things they were dealing with.
So let's start out just by talking about, when you say what they were dealing with. You got sick from mold?
I got sick from mold, yes.
Okay, so I'm going to make my long story very, very short, just so we can talk about your story. But my office was destroyed by Hurricane Wilma.
Okay.
And my attorney said, Phil, get out of that office, never go back.
Okay.
And I said, no, Roy, this is my livelihood and my staff and my clients, and I got to rebuild it. And he said, you should not go back in a water damaged building. I said, come on, I'm strong and I can handle it. And I was in there as the contractors are ripping out the rotting drywall and dragging out the carpet, and they have masks on and I don't.
Yeah.
So I didn't know. I honestly didn't know. Yeah. Mm-hmm. So now, the long story short, I wind up going from doctor to doctor to doctor, trying to find out what's wrong. So I developed some really odd symptoms in a cascade, and they wound up neurological, and I was misdiagnosed with Parkinson's.
Okay.
Thank God I didn't accept the diagnosis. I mean, I did in the moment, but I thought about it, and I just said, maybe, just maybe, the doctor was wrong. And this was a prestigious doctor, but clinically, I guess I was displaying textbook Parkinson's symptoms. He did some MRIs on my brain. I had a lesion in my left frontal lobe, and there were certain things that lined up.
Okay.
Then I met Dr. Richie Shoemaker, and he said, were you in a damp building? And I said, yes, I was in a damp building. Yeah. And we did some new testing, and he introduced me to markers like MMP9 and MSH and things I'd never heard of before. Yeah. And he said, you don't have Parkinson's, you have mold toxicity, and we're going to get you well. And I started on cholestyramine and some other things. And literally within 10 days, everything was gone. Every symptom was gone. So, that taught me a lot. Yeah. And one of the things it taught me is a diagnosis is not necessarily fact. But the second thing is our bodies have an incredible ability to recover when we figure out the strategy. Absolutely. So let me now pass the ball to you. Short version of your story.
Oh, my story. Okay. Back 2005, I initially developed daily fevers, saw an infectious disease expert because I was working with very young children and I needed to be sure I wasn't contagious. that continued and progressed for 10 months, involving symptoms in almost every organ system, biopsies of lungs, bone marrow, skin, esophagus and stomach, 2 hospitalizations, more than a dozen CAT scans, PET scans, I don't know, 18, 20 physicians, and was getting worse and not better. And during that time, our daughter, who was almost 6 at the time, developed a pneumonia as well, which was really unusual. And at some point, I started moving furniture and saw a black spot behind the wall at our home. And that started the process of us getting our lives back. And yes, I received a lot of diagnoses too. The last one I received was, this was before it was renamed, was chronic fatigue syndrome. And I was told to just, you know, go on disability, you know, this is gonna be a while, you know, and it's kind of like you, it just didn't sit right. You know, this wasn't me, this was never me. It just didn't make sense, and we didn't quit. My husband's a physician as well, so we had looked, you know, along with the doctors who were working with me, we had looked into the most, you know, obscure things we could look into, and still hadn't figured it out. And the day we found that little moldy spot was the day we could all get our lives back.
Now, you're an MD, correct?
I'm an MD. Family practice is my original training and board certification.
So did that experience change your focus professionally?
Completely, yeah. Yeah. Once you learn something, you can't unlearn it. And it made me very interested in learning more, because in my case, which is true for a lot of my patients, things got much better getting out of the house, but the switch doesn't turn on completely for some of us. We're not completely normal the minute we get away. So although it was obvious that there was a huge improvement, there was still some work to do. And so a lot of the original learning I did was to help my family. And I became more and more interested in environmental medicine, went through their training process and got board certified in environmental medicine, and then later in integrated medicine. And so one of the first things it did was make me think of a handful of people in my previous practice that almost certainly had environmental illness. Because, you know, you look back and you think, I was trying so hard, I was listening. I wasn't just writing it off to whatever, depression or whatever, and still, you know, just we hadn't figured it out because I didn't have the tools then.
And so these are people who are falling through the cracks and being told they need Lexapro and Xanax.
Exactly. Because long time ago, when I went to med school, they used to teach us that if you had symptoms in multiple organ systems, then it had to be a psychological condition, because it wasn't possible to have, you know, so many different symptoms. Now I think we're getting that inflammation affects the whole body. So I don't think we're looking at it like that, but I was kind of right in that process where, you know, we were being told that, you know, if people are achy and nauseated and they have, you know, all these different symptoms and neurologic symptoms, and you can't really find a cause, then it had, that they needed the antidepressant prescription.
If I make the statement, inflammation is the root cause of all chronic disease, does that sit well with you, or do you need to correct me?
I would probably have to think of, well, yeah, it sits pretty well. I mean,
would you say that
there might be some pain syndromes that have something going on that's slightly different than chronic inflammation? You know, there may be some that slip through the crack, but it's pretty close. Yeah, I think that addressing inflammation would take us a long way into improving most, if not all, chronic conditions.
Would you say that conventional medicine would recognize that statement as openly as you do?
They're getting closer. Maybe not quite, but they're getting closer, I think.
More now than a decade ago.
Absolutely, yeah. And very much so, including psychiatric conditions. You know, I remember reading in JAMA, they were talking about a handful, I think it was depression, and I believe autism was in there, schizophrenia, and that was maybe 3 years ago, and they were discussing the inflammatory nature of those illnesses. And then the next step was, they have treatments for inflammation, of course, like the biologic things you use for autoimmune conditions. So I think that's why, you know, it was of a special interest. But that surprised me when I saw that they were recognizing that, and even in the psychiatric community, because that's exactly where, you know, they hadn't really been acknowledging the problem.
Right. Now, I'm going to guess that people come to you after they've exhausted other possibilities and after they've received a host of diagnoses, correct?
Very commonly, that's true. Sometimes they get referred early through a friend or, you know, another doctor who's familiar with me, but what you described is the most common situation.
I'm also going to guess you have a good collection of heartbreaking stories from people you've met.
Absolutely, yeah.
And I can tell this about you. You're an empath.
Yeah.
You care about people.
Yeah. Yeah.
So tell me a success story other than your own. Tell me a story of a patient who came to you with environmental illness that found an answer.
Well, there's one that's very similar to what you went through, and it was a man in his 50s who had returned from the Mayo Clinic with the paperwork for his ALS, newly diagnosed ALS condition, and most of the paperwork was of the nature of, these things are going to happen and you're going to stop being able to eat and get your affairs in order. And, you know, that was what he had received. He came in with his wife from out of state, and through, you know, getting to know him and his situation, there were two very significant exposures that he had. One was a moldy home, and the other was he was a rancher working with pesticides frequently and had been for many years. I forget who referred them to me because they were from out of state, but by the time they got there, we had our evaluation, and, you know, I looked over things and recommended a treatment, which included getting away from the exposures because that was essential in order to improve. They did it, and he got better, and the family has since told me that they actually took all his records and had him, you know, had them reviewed at Duke University, and they apparently told him, yes, you had ALS, and, you know, through the treatment, you no longer have ALS. So that is exciting. That's amazing, really. And I'm not going to say that everybody out there diagnosed with a severe chronic neurologic condition, you know, is guaranteed going to recover through environmental treatment. But I would say that if your health is falling apart and you don't have a reason for it, it pays to pay some attention to the environment and look into things. Also, the consequences of these environmental exposures on your body need to be addressed as well. So, so that one was, that's definitely a nice success story.
So, you know, chiropractic was built on this idea of, if we remove the interference, I'm talking to an MD about chiropractic, if we remove the interference, the body can heal, right?
Yeah.
And that was kind of its own category of medicine, and doctors didn't even consider that medicine. But when we just think about that as a concept, when we remove the interference, the body can heal. That is an absolute historical truth that goes back to Hermes. It's just sort of like mainstream medicine forgot. Mainstream medicine began to believe that an illness is a drug deficiency, and that was flawed thinking, correct?
Yeah, obviously, yeah.
So, you know, when I meet anybody with chronic disease, what I look to as an ultimate answer is finding the correct balance between appropriate stress, not no stress, but appropriate stress,
Yep.
and recovery. And that's what people need to understand is, yes, the body can heal if we restore parasympathetic recovery. If we can get the immune system to function the way it was functioning when you were born, and if we can get the sympathetic and parasympathetic systems in balance, your body can do amazing things. Now, with that said, what I find is sometimes it's hard to get people to take responsibility. So I hear people blame the doctor and the doctor blame the patient. And the fact is they both need to take some kind of responsibility here. Do you agree with that?
Of course. Absolutely. Yeah. Yeah.
So, you know, doctors will say to me, well, the patient comes in and all they want is the medicine. All they want is the drug. And I understand why they think that. But the patient believes that because a celebrity on television told them in a TV commercial that they should go to the doctor and ask for Lyrica, whatever the drug is, right? They say it to them. Go to your doctor and ask for. So the person goes like they're hypnotized. They come to the doctor and they say, I need whatever the drug is.
Mm-hmm.
But when people start to understand that they have a role to play in this, they suddenly become empowered. Now, what prompted that line of thinking in me right now is you told me that the patient you were talking about got away from whatever the toxin was or the mold or the pesticides. And very often when somebody asks me initially what they should do because they have mold, I say, get the out of your house. That's where we start. And they go, well, no, I can't. I got people coming in to remediate. And that's the blockage.
Yeah.
So I wish I had listened to my attorney. That's why I told you that. He said to me, never go back in that building. So the fact is, I never had to go through that experience. But we're stubborn and we don't listen. And that's why I want you to reinforce that for anybody who's watching us now. Get out of wherever it is that is making you sick, right?
You have to do it. There, you will not heal in that environment. You know, it's like trying to heal a burn or while you're standing in a fire. You're never going to get there. So the sad part about this illness, though, is for a lot of people, it takes away their motivation. They feel so sick and tired and overwhelmed, and their stress tolerance is depleted. And it's, you know, that's the really sad part of it. And I had a patient recently who got out, young woman, and she'd been there and she knew she needed to get out and finally did. And she described it as the mold spell. You know, she went back briefly for Christmas and said, you know, I could feel the mold spell kind of keeping her there. And that there's something about this particular, there is stubbornness, there's financial concerns, you know, there's a number of blockages to taking the action that people need to take. But also you're dealing with people who are not at their best. They're really depleted. And if you could get them to understand that if they made that change, everything could look completely different. You know, and I do spend some time trying to get that through, you know, in a way that connects with people. And the other thing I found is it is not strictly a financial thing. I learned this first from my husband. He had a patient, he worked with a lower income population, and he described to me someone who went on the streets, became homeless, and came back and thanked him because they got out of a moldy apartment. You know, that person took the action and felt so much better. And I've seen people with limited resources make changes, and I've seen people with less limited resources not make the essential change. So, and of course, these are people who've actually taken the step to come and see me, who's known as a mold doctor, and then still not making the change. You know, they were okay to come and listen, but it is very interesting. I think it's maybe different parts for different people. They don't believe it. And of course it's a big deal. I get that it's a big deal. You know, I approached it extremely enthusiastically because having been as sick as I was, and really the whole family was sick, as the rest of it didn't matter. You know, the idea that we could get our lives back, you know, overpowered everything.
Whatever it takes.
Whatever it takes. And there are people like that I see, but not all. And that's you know, and I understand the reasons why, you know, the struggles that they're dealing with to get it. And also, like anything in life, people go through their own process and they do things when they're ready to do things, whatever it might be. But really, I just wish they could get that life doesn't have to be the way that it is when they're living in an unhealthy building.
Did you deal with chemical sensitivity?
Oh yeah. Yeah, that was part of it. That comes on often when you first leave, and you start getting treatment. And usually it's the strongest for the first 6 months or a year. And I still remember the night that I had to get out of the room because I could not stand my husband's deodorant, which was the exact same deodorant that he had worn the entire, you know, whatever, 15 years
I understand.
at that point.
Yeah.
And luckily he got it too. I mean, he became chemically sensitive, and, you know, he once had a patient who was complaining to him about headaches, and he kind of said, yeah, your cologne is giving me a headache. You know, it's like, so I was fortunate that we were on the same page there. But
yeah, you know, it almost becomes an undesirable superpower.
Kinda, yeah.
Because you're recognizing how potentially harmful it is at an amplified level.
Yep.
Right? I mean, if it's affecting you that way,
Yep.
obviously it's affecting everyone. They're just not as sensitive. Right?
That's it. So this is how I kind of tell people to look at it. You're going to go through a time of being very, very heightened in your sensitivity. It is a superpower. It does let you know this is something that, you know, it's best to not be around, and that's important information. But also to approach it in calm and deliberately, and not trigger the full fight or flight situation, because that tends to keep people from healing. It's you can't heal when you're in, and it's really scary when, you know, your home turns on you and you don't know if you can feel safe somewhere. And I understand all of that, but I just try and empower people to, you know, identify a problem and solve the problem, and to keep them in that mode, because that keeps you from panic, fleeing urgently, you know, that kind of stress, which is really hard for healing.
Yeah, well, now we have the two monsters together. We have inflammation and we have adrenal stress, right? And if you create sort of a neural habit where anytime you're around a smell, an odor, a chemical, a fragrance, you go into adrenal stress, you're training your nervous system to react. Yeah. So now there's a psychological element of this too, that we have to help people with. So it's not a drug that will fix them.
No, and luckily, if I am treating them early on in this process and can coach them and tell them what to expect, it really, I haven't seen it become a severe problem.
So the good news is, I got well.
Yeah.
You got well.
Yep.
Your patients who listen to you are getting well, right?
Yes.
And then somebody takes the world and shakes it with this COVID monster.
Yep.
So I'm going to kind of just open that door. And what do you want to say about that? Because honestly, we can go in so many directions. I'll just kind of open it up.
What do you say about it? You know, the world is changed in a way nobody, I don't think really many people alive today have experienced it, you know, given that it was over 100 years ago, the last pandemic that we had. We're being...
No. It was actually, I think it was 1996. Dustin Hoffman, Cuba Gooding Jr., Donald Sutherland, and Rene Russo in a movie called Outbreak. I actually watched it the other night, and it's actually a good movie, but it's eerily predictable. You know, it's kind of like, well, 30 years ago, we knew this was possible.
Yeah.
So, you know, it's a good movie. Probably not good for everyone to watch now. Yeah. Certainly not for people in adrenal stress. But, I'm just teasing. Yes, it's been 100 years, and it's never been like this.
Yeah. So in that sense, we're all kind of in the same boat. None of us have ever experienced this before. And yes, circumstances are harder for some people than others, depending on their living condition. And in terms of how it's affected people emotionally, that's one thing that has actually struck me as interesting, because you'd think it would be a mess for everybody because, you know, our future is unknown, it's very stressful, we're, you know, and it is a very mixed bag, because for some people, you know, kids, I have a friend who works with kids with digestive problems, you know, emotionally related. She said they're all fine now. They don't have to go to school. They don't have to, you know, so a lot of people with certain types of anxiety are doing better. It's really,
I guess it's the agoraphobic stream.
yeah, I guess so. Yeah. And then everybody's having to kind of, you know, rethink how the world's going to look, and because it's very unclear right now, and there's some really neat things happening, and there's terrifying things happening, and heartbreaking things happening, and you know, even the people who are deep into the research of this are barely scratching the surface of understanding how this is going to play out. And that's again, it can be terrifying or it can be empowering, in that we're all in a position to learn and think about, you know, how things are going to be and how we're going to behave and look at things in the future. So
what advice do you give your friends? I'm sure they ask you because you're a doctor. So
sure. I mean, there's a bit of medical advice that I've given. The stuff I can pull out that that, you know, got my attention early on, almost immediately when I heard about the groups that were having the most problems. I wondered about a certain class of medications, the ACE inhibitors and the ARBs. And very soon I found a guy who wrote a letter about that, a Swiss doctor, and he talked about how that they enhance the binding of the ACE2 receptor, which is where the SARS-2 COVID-2 binds. So there was concern that that would increase risk. So I remember sharing that because that had my attention. Of course, I just read official recommendations or don't change anything, but just from what I read, that was of concern to me. Ibuprofen making things worse potentially also was something I thought was important to mention. I'm glad that it has been encouraged to wear face masks in public now, because that always was clear to me that that makes more sense than not. And, you know, we're in a shortage, which is really, really unfortunate and, you know, upsetting that we still have a shortage for healthcare workers. But I am glad that we've at least been encouraged to take that obvious protective measure, even if it's with a, you know, cloth covering. There's not that much, you know, I've advised a few patients on things to have at home in case they get sick. You know, generally the usual, everything we can do to help with health, immune system, stress control, and taking the precautions. I don't have to tell, here where I am, people seem to get it and get that, you know, we need to do the social distancing or physical distancing right now. So I haven't, you know, had to convince any, I mean, they're already there. So
yeah. And I don't mean to put you on the spot and ask you for an answer, but are you
no,
comfortable with the words, are you comfortable saying to people, I don't know?
Of course, nobody knows. I mean, you know, like I said, I've tried to extract the things that I think could be immediately relevant, like, you know, things that might make it worse, or, you know, that might not, you know, but the people might not have immediately seen that information, because I'm constantly scouring it. So I tend to pick up on the things a little bit earlier, but now, you know, it's getting more widespread attention.
Well, I invited you into the group 55 days. I appreciate you coming in, and you're welcome to come in at any level you want and share information, share thoughts. But, you know, I think things will come out of this, and an important, we can call it a wake-up call, is immunity is something we earn when there is no threat. Like, people are seeking immunity now because there's a threat. Those who have healthy immune systems are not as threatened, right? So you can't run and buy some vitamin C in the store now and believe that suddenly you're invulnerable. If you have a compromised immune system, stay away. Honestly, stay away from people, stay away from risk, stay away from threat, stay away from all of it. But on the other side of this, there should be some recognition that you probably could have lived a little better, right? In terms of taking care of yourself. So what would be your advice in that regard? When people get those lessons, when we come out of this, what should they do differently just as a population of sedentary people who don't take great care of themselves?
Well, obviously move. Yeah, none of my patients get a pass when it comes to encouraging them to engage in whatever form of physical movement that they can. And no matter how minimal it is initially. So clearly keeping physically active. I think the emotional and stress side of it, I put those two as, not that nutrition isn't important, it certainly is, but stress, sleep, and physical activity are huge, and they aren't things that should just be dismissed and put off, and until you have time to do it, or because you don't know, you want to be in top form at any time. And so that might be something that people are recognizing. I want to be very clear though, I wouldn't want anybody to feel bad or that they deserved it due to any health conditions or choices that they made, because this virus has, there is a mystery to this in terms of, who's gonna get creamed and who's not even gonna know they're sick, and we haven't cracked the code of that yet.
Yeah, and there's also a naivety. I mean, a lot of people get very caught up in a conspiracy theory, and I'm not taking any sides here, but the worst thing that you could do is just fail to believe that there's something out there that you need to avoid. So whatever you believe about the conspiracy theories, let's attack people afterwards. But for now, stay home, be safe, and take care of yourself.
Yeah, that for sure. And, just find maybe parts of your life that you were doing automatically that maybe weren't working great for you now that you have a minute to look at it.
Here's a little bit of perspective. I chose 55 days because I just chose 55.
Okay.
That's the truth. There's no science behind it. I didn't use mathematical formulas. But when I looked at a calendar, I said 55 days from the day we start will be June 1st. Let's approach this with optimism. People ask me, do you have inside information? I don't. Will we be over that? I don't know. That's my answer. But let's choose a finite period of time where collectively and individually, we can work on being the best we could be. So all of the excuses, I have to go to work, I'm sitting in traffic, they're gone, right? So let's not sit all day and watch the news, but let's exercise. And I'm giving people programs to do that at every level. Let's eat supportively. And I have some great coaches helping people. And let's be sensible about balancing stress, load, and recovery. And everybody can come out better. And then we'll get our lives back at a higher level. I'm hopeful that's how it will play out as well. I look forward to things coming back to normal, getting back to the regular podcast, having you on as a guest. So I appreciate meeting you. I appreciate you joining us. Anything you'd like to say in closing? No, I'm happy to be here. I appreciate what you're doing, and I hope everybody is able to stay obviously healthy and safe, and find ways that they can even thrive and improve themselves. And you know who has no challenge with parasympathetic recovery? Your cat. Not a bit, no. That cat is within a few inches of me almost wherever I am. So, yep, exactly. That's what animals are very good for.